Hello everyone, I'm Dr. Nisar, consultant ophthalmologist at Sunrise Eye Care Kannur, Divine Eye Care Srigandapuram. I hope everyone is safe and I hope everyone is adhering to all the safety protocols to beat this pandemic. Well, today I'm going to talk to you about a person who's actually a thief. He's going to steal your vision over a period of time and is not going to give it back to you. But the good news is we will help you how to not let him do that. Well, today I'll be talking about a disease known as glaucoma. The reason is from March 7 to March 13, it's Glaucoma Week. It is a global initiative of the World Glaucoma Association to create awareness among people about glaucoma, the importance of periodic eye checkup, and to detect glaucoma at early stage. Before I talk about glaucoma, I'll tell you how human eye is designed. Human eye is designed in such a way that the light rays emerging out of an object will enter the human eyeball, and with the help of various structures they are converged and relate onto a structure known as retina. Retina is actually a layer filled with nerves, and they receive all these light rays and they convert that into an electrical impulse. Later, these electrical impulses will be carried to brain via a structure known as optic nerve for visual processing. Glaucoma is a disease of this optic nerve which slowly progresses, and later on the patient is going to end up with blindness. But the good news is if it is detected early, the entire process can be halted but not reversed. That's exactly why it is known as preventable blindness. Now, I'll talk to you about the symptoms of glaucoma. Glaucoma in its typical form, the most common variety, open angle glaucoma. When glaucoma starts off, patient is usually asymptomatic. But later on, over a period of time, the disease progresses. The patient will have loss of visual field and he'll end up in blindness. Well, in one more variety, known as angle closure glaucoma, which is actually a medical emergency, patient can have severe painful red eye and he has to be attended as soon as possible. Now let's talk about people who are at risk of glaucoma. Number one, age above 40. Everyone is at risk of glaucoma age above 40. So it is very important to get a periodic eye checkup once you're above age 40. Point number two, strong family history of glaucoma. Patients with family history of glaucoma are always at risk of glaucoma. Number three, long-term use of steroid eye drops. Ideally, steroid eye drop, which is used to treat various allergic conditions and inflammatory conditions, it is used in a tapering fashion. But if it overused, it can lead to glaucoma. And number four, usually patients with a history of trauma, if you have an ocular injury, you are at risk of developing glaucoma. Now let's talk about what are the tests basically done when you go for a glaucoma checkup. Number one is your visual assessment as a basic test. Number two, your intraocular pressure, which is eye pressure, will be assessed. Now that doesn't mean that glaucoma can always have raised intraocular pressure. There is an entity known as normotension glaucoma, where you still have glaucoma but your intraocular pressure is under control. Next, the most important test, where your ophthalmologist will visualize the back of your eye, the posterior segment of eye, basically where he will visualize optic disc. Optic disc is the anterior most part of the optic nerve, the visible part of optic nerve. It is typically done by using various lenses. I'll show you one such lens. This is a typical 90 diopter lens. An ophthalmologist will use this lens to visualize the optic disc. And what is he going to visualize? Classical change, which is known as cupping. And finally, one important test known as HFA, where field loss is evaluated with the help of a computerized test and you get a report. Well, there are various other steps, but in this talk, I'm going to touch upon the most common and the basic tests. Finally, let's go to the management part of glaucoma. There are various factors that influence the management of glaucoma. Number one, what kind of glaucoma you have. Is it an open angle glaucoma, or is it angle closure glaucoma? Number 2, what is your intraocular pressure? Number 3, your systemic conditions, like you have any cardiovascular diseases or any respiratory disorders. Number 4 is your age and financial status. All those play a very important role in designing treatment for an individual. The most common treatment strategies available are medical as well as surgical. Medical includes using topical eye drops to reduce your intraocular pressure, or using oral tablets to reduce intraocular pressure in case of an emergency, or using lasers. If the patient doesn't respond to medical therapy, he will be subject to surgical management to bring the intraocular pressure down. This was basically a very basic and bird's eye kind of talk about glaucoma. I hope now you have some kind of idea about glaucoma. Do share your knowledge, your ideas with your friends, family members, and help us in making this glaucoma week a meaningful one. Thank you everyone. You have a wonderful day.